This is to commemorate the Mental Health Day, and we have with us Dr. Rox and Dr. Gina. Neha, would you kindly share the screen? It is indeed my pleasure to introduce to a few PhD from science. Last night, speak about adolescent mental health and impact of food on it. We were really happy to have her talk to all of us. And therefore, the second session that we have involved her in, again, we are very much looking forward to your session, Dr. Rox. She has been leading several research projects exploring the relationship between diet and mental and gut health. So we will be enlightened a little more about this today, including investigations in individuals who have got eating disorders as well as post-traumatic stress disorders. Currently, she is leading an internationally recognized free online course on food and mood that is improving mental health through diet and nutrition. And she's having a whooping more than 69,000 enrolled participants in this for this particular course. So we welcome you, Dr. Rox, once again. Now coming to our second speaker. Our second speaker is none other than Dr. Gina Hovland. Now she is a clinical psychologist. She is having her private practice and she holds a number of degrees in psychology as well as teaching. Gina has a wealth of experience in provision of evidence-based clinical services to individuals who have got complex trauma needs across a wide range of settings. So indeed, something which is very, very important and necessary in today's world. Australia's first board-certified lifestyle medicine professionals. She's a part of that and has a particular interest, especially in nutritional psychiatry. Really very, very interesting field. It is emergent from this is the passionate focus on the nexus of diet and trauma symptoms. Currently, she's conducting her PhD within the Food and Mood Center at Deakin University. Gina is developing and will pilot an online dietary intervention for those at risk of post-traumatic stress. So welcome to you, Dr. Gina, would be Dr. Gina Holland once again. And we have a host of participants waiting to hear both of you. Yes, Dr. Rox. Yes, I think Dr. Rox can begin and yeah.
Beautiful. Thank you very much for such a wonderful introduction. My apologies. I will have to turn my camera off because my internet is quite unstable. But I will switch it back on when I'm answering questions. Good day, everyone, and thank you for having me here today. First, I would like to acknowledge the traditional owners of the land from which I'm meeting you. And for me, it's Vadavarun people of the Kulin Nation, and pay my respects to their elders, past and present. I extend that respect to all First Nations people here with us today. I'm coming to you from a Food and Mood Center, Deakin University. And today we're gonna have two-part seminar. So I will lead first part and discuss with you the relationship between gut and mental health and talk about gut microbiota-targeted therapies in mental health. I'll talk about biological mechanisms that link diet and mental health, discuss gut-brain axis, and outline some of microbiota-targeted interventions based on whole diet, FMT, pre-syn and postbiotics, and fermented foods. It is quite interesting that in the past, mental health has been viewed somewhat in isolation from whole person health. Diet or many other aspects of lifestyle lifestyle, such as physical activity or social support or even sleep, seldom came into treatment, let alone into prevention of mental health disorders. However, we need to view our patients and ourselves, of course, as a whole person. Presently, we consider multiple biopsychosocial factors that might increase risk for mental health disorders. For example, we understand that genetics might play an important role in this mental health mix and explain about a quarter of all mental illnesses, with heritability disorders such as schizophrenia and bipolar disorder are much higher than, say, in depression and anxiety. Biological mechanisms also contribute greatly to development and progression of mental health issues, and I will talk about this today. Environment is another strong player in the mix, and we only need to refer back to current pandemic to appreciate how much our environment impacts our mental health. But absolutely critical in our present understanding is that lifestyle practices that are largely modifiable, including diet and nutrition, are also both increase the risk for developing mental health disorders and impact their management. And these factors should be viewed in our whole body approach in mental health. When it's come to diet, we see evidence that it's central to human physical, mental, and brain health across all life stages. Studies show us that in earlier life, diet quality of mothers during pregnancy might have a say in behavioral symptoms in children. In teenagers, we also see how a diet impacts on cognitive performance, on mood, and on their feel for quality of life. In adults, consuming higher quality diet decreases risk of developing common mental health disorders, such as depression, by about 30%. And later in life, diet supports many aspects of healthy aging by reducing the odds of frailty and cognitive and neurodegenerative disorders. There is a number of closely linked biological pathways which show us why and how diet is impacting mental and cognitive health. Although most of the studies that are done to date on biological dysregulation has focused on depression, we understand that other conditions in mental health, such as anxiety or bipolar disorder, schizophrenia, share these pathophysiological characteristics and regulatory pathways. For example, over a quarter of people with neuropsychiatric conditions have increased level of inflammation or that hyperactivation of immune system. Then when we look at oxidative stress or that imbalance of oxidative and antioxidant processes, it's another feature of mental health disorders, and research shows elevated levels of oxidative stress markers in people with depression and schizophrenia. When we look at HPA axis, we see that about 60% of people with depression have that excessive cortisol production that decreases with recovery. Then when we look at a hippocampal neurogenesis and BDNF production, mitochondrial dysfunction, all these pathways are involved in mental disorder development and progression. And all of these can be targeted and supported through diet. Out of all biological mechanisms, the gut microbiota is arguably the strongest player by itself due to the developing understanding of the gut-brain axis, but also as a modulator of inflammation and neurogenesis and metabolism. First, let's us all get on the same page about gut microbiota. Two terms usually been thrown around when we talk about gut microbiota: microbiota and microbiome. Sometimes these are used interchangeably. So to clarify, our intestinal microbiota includes trillions of microorganisms residing in human gut. These include over 500 unique species such as bacteria, archaea, fungi, parasites, and viruses. Usually, term microbiota is used to identify all microorganisms, where term microbiome is for a definition of a broader environment that includes microorganisms, their metabolites, and whole genome. Each and every one of us has somewhat unique microbiome. Of course, there are similarities depending on multiple factors, including our state of health or disease. Also, depending on a place in the system, the composition of gut microbiota varies. However, when we look at complexity and concentration of bacteria, it increases as we descend in the GI tract. In the stomach, for example, the majority are lactobacilli. As we descend in jejunum and into ileum, concentration and diversity of bacteria increases dramatically. Up to 10 million bacteria reside here. The main source of fuel for gut microbiota are non-digestible fibers that humans consume, fibers from fruit, vegetables, whole grains. However, the gut microorganism consume pretty much anything in their side along with fiber. These also produce metabolites such as short-chain fatty acids, and the role of gut microbiota composition and function has been implicated in a broad range of conditions, with not a week really going by as we learn something else about this exciting area. Broadly, the very position of gut microbiota in the body, in the gut, one of the largest organs, puts that is one of the key organs. When you think about our gut microbes have to deal with absolutely everything in our environment: food, medication, water, air, dust, microbes, viruses. No wonder it plays a role in several body systems. Yet in relation to mental health, past theory mainly limited etiology of mental health disorders to genes and stress, with treatment options narrowed to psychotherapy and medication. However, development of neuroscience and bioinformatics afforded new exploration of the role of gut microbiota and the implication of microbiota in that microbiota gut-brain axis. Our present understanding is that some of mental health disorders could be really viewed as dysfunction in microbiota gut-brain axis with various diet-linked treatment options. Several psychiatric disorders have been associated with so-called dysbiosis. Dysbiosis is that perturbation of microbial community. I need to point out here that it's very much a concept and not yet a construct. We don't really know how healthy gut microbiota should look. So it's very difficult to exactly describe gut dysbiosis. Basically, the theory of dysbiosis is within intestinal permeability and translocation. So bits which are not meant to go through. That's very scientific explanation. Dysbiosis, of course, increases pro-inflammatory communication, which in turn increases intestinal permeability and stress system of the brain, directly or via vagus nerve and visceral afferents. Pro-inflammatory communication has been demonstrated to impair negative feedback within HPA axis and induce cortisolemia, Elevated levels of cortisol and inflammatory markers have been also linked to anxiety and depressive disorders. This communication is, of course, bidirectional, whereby increased stress can result in elevated cortisol, which is communicated to the gut, and this has implications for immune function, intestinal permeability, and gut microbiota. Evidence show that gut microbiota of people living with mental health conditions very much different to the gut microbiota of people living without mental health issues. However, it's not completely clear if gastrointestinal dysbiosis is due to disease or environmental factors, and if these differences in gut microbiota composition could be considered as the cause or as the consequence of mental health disorders. Given our increasing understanding of the role that microbiome plays in our health maintenance, and with the evidence from preclinical studies, microbiota manipulation represents a very promising tool for adjunct therapy and the treatment of a number of disorders and their associated symptoms. What's important to keep in mind here is that prospects are largely based on preclinical studies. Clinical evidence or studies in humans are coming from very limited number of small investigations, but these are increasing. Also, most of the microbiota-focused therapies are conducted as adjunctive treatment. Therefore, we need to keep in mind that questions such as what is true impact of the psychiatric treatment on gut microbiota, or what is the true impact of gut microbiota on the efficacy of the psychiatric treatment might be difficult to isolate and unpack. With all these cautious questions in mind, let's consider several novel approaches to treatment and prevention of poor mental health through diet and gut. These novel microbiota-targeted approaches include probiotics, prebiotics, symbiotics, postbiotics, fecal microbial transplant, whole diet, and fermented foods. First, let's focus on whole diet right here. Diet is, of course, one of the major factors involved in shaping the gut microbiota composition across the lifespan. Remember, I mentioned how diet plays the role in mental health across the lifespan. It's absolutely logical to look at gut microbiota as a missing link between diet and mental health. We see that during prenatal period, maternal diet influences cognitive development of the offspring, potentially through some microbiota-mediated mechanisms. In infancy, breast or formula feeding right here impacts the microbiota composition, and the emerging research suggesting that this is what could be affecting brain development and behavior of children. During childhood and adolescence, the microbiota gut-brain axis continues its development, and this could be why in this period in life, diet is particularly important for proper development of the axis and potential decrease in the risk for mental health disorders later in life. And I did discuss that last week, how half of all mental disorders are actually first appear before the age of 14. So we think that gut-brain axis have a lot to say in this development. In elderly individuals, the microbiota again undergoes changes, which could be driven partially by dietary intake. Some of these changes are inevitable, but diet also plays a very important role. These changes in microbiota could be linked to frailty and cognitive function. And I've presented to you about this a couple months ago during the conference on healthy aging. In the gut, various dietary components such as fiber, polyphenols, probiotics in fermented foods and as supplements, plant-based proteins, stimulate the diversity and growth of thought to be beneficial bacteria, such as Bifidobacterium, Akkermansia, or Prevotella. These dietary components also modulate potentially pathogenic pro-inflammatory bacteria. Dietary fibers are essential for productive or bioactive metabolites. Remember, I mentioned that dietary fibers provide the food source for gut microbiota. And then gut microbiota produces metabolites such as short-chain fatty acids. Short-chain fatty acids enhance the intestinal barrier integrity. Remember, I was talking about dysbiosis and translocation. So consuming diets which then produce or improve the life and function of bacteria which produce short-chain fatty acids, particularly butyrate. Also implicated in supporting this blood-brain barrier, protecting the brain from neurotoxic components. Dietary intake is also directly influences production of neurotransmitters, such as serotonin, and various gut hormones with neuroactive potential that affects brain, cognition, and behavior through signaling, hormonal, and metabolic systems. Human research shows that whole food-based diets, such as Mediterranean or plant-based diet with high consumption of fruit, vegetables, whole grains, legumes, seeds, and nuts. So all these foods which give us a lot of prebiotic fibers, and low consumption of Western type foods, highly processed foods, beneficially impact gut microbiota composition, and in turn associated with better mental health outcomes. Now, let's consider fecal microbiome transplant, or FMT. Of course, FMT gained popularity over the past few years, given its success in treating several gastrointestinal diseases. But the idea of FMT can be tracked back to Chinese civilization, nearly 1700 years. In the 4th century, well-known traditional Chinese medicine doctor successfully treated patients who had poisoning and severe diarrhea with human fecal suspension. When we look through history books, they tell us of FMT use over the past years in various situations when either human endeavor or necessity resulted in this form of treatment for various gut-related disorders and illnesses. The modern process for FMT is much more sophisticated and controlled, and is regulated very well, particularly in countries such as Australia, UK, or US, similarly to, say, blood banks. Healthy donors are extensively screened, stools are collected and analyzed for several consecutive days, and depending on administration methods, microbiome is packed, either in capsules or animals. Administration to patients is performed under strict supervised, controlled, and monitored conditions. FMT could potentially provide accessible and non-synthetic treatment for many challenging gut-related disorders. In the last decade, FMT have been successfully used in treatment of recurrent infections and ulcerative colitis. There's also investigations on using FMT during chemotherapy treatment for cancers to restore the balance in the microbiome disturbed during the treatment. There's also trials that combine the use of chemotherapy drugs with FMT in hope of cancer and tumor cells by modulating the immune response of the body. With the continuous increase in the burden of neuropsychiatric disorders, and we know that mental health disorders are currently the leading cause of disability in the world, with over a quarter of whole world disability is attributed to mental health disorders. So of course, there's urgent need for different treatments. Therefore, there is growing interest in using FMT and treatment of psychiatric symptomology. The evidence based in FMT in psychiatry is growing slowly, but it is a very promising area of research. The outcomes of this systematic review suggested that there's some strong evidence for the treatment of psychiatric symptoms through FMT. This paper reviewed 21 studies that investigated impact of the FMT on mood and behavior indicative of psychiatric well-being in various samples. In its result, it presented a mix of clinical studies, so studies conducted in humans, overall 8, preclinical with human donors, 9 studies, and entirely preclinical, so studies in animals, 11 studies. Interestingly, that all studies reviewed found a decrease in depressive and anxiety-like symptoms and behaviors. The inverse association was also found with the transmission of depressive and anxiety-like symptoms and behaviors resulting from the transmission of microbiota from mentally ill donors to healthy recipients. Quite an interesting area. In our center, we developing a trial on FMT treatment for major depression. So hopefully in a few months, I will be able to present the results of that trial. Another promising area of research and treatment is probiotics. Out of all microbiota-focused therapies, probiotics perhaps the most investigated. General consensus here is that probiotic supplementation has several beneficial effects on human health. However, evidence is far from consistent. I will tell that I keep saying to you this, that in mental health and diet-related treatment, the evidence is far from consistent. When it's come to probiotics, one of the possible explanations of this inconsistency are the diverse mechanisms that are likely to drive that probiotic benefits to host health. When we look at the interactions of probiotics with the host and host microbiota, we should consider the complexity of physiological processes that are actually influence this three-way, tri-directional interaction. For example, we see that consumed probiotics could interact directly with immune cells of the host. Probiotics also interact with gut microbiota via antimicrobial production cross-feeding of residential species. This might also compete for both nutrients and for location. For example, imagine a probiotic supplement as a parachute descending into rainforest. Rainforest being, of course, our gut. So when you think about it, this parachute might land favorably or might get stuck somewhere in high trees or get swept away by a river. So simply, when you think about probiotic treatment, this tri-directional communication and this complexity of gut microbiota should be considered. The impact of probiotics on mental health have been trialed in various populations with quite mixed outcomes. For example, this earlier randomized double-blind placebo-controlled trial examined whether probiotic supplementation can reduce symptom severity in patients with schizophrenia, and also looked whether probiotics are associated with bowel functioning. The study recruited 65 outpatients with schizophrenia who were randomly assigned to 14 weeks of double-blind adjunctive, so it was alone with medications for psychiatric symptoms, so adjunctive probiotic treatment. So the probiotic strain was combined lactobacillus and bifidobacterium. And that was compared to placebo therapy. Psychiatric symptoms were assessed bi-weekly with positive and negative syndrome scale. And patients also were queried or surveyed weekly about their gastrointestinal functioning. The result of this study showed absolutely no significant differences in the schizophrenia-related scores, so positive or negative syndrome scale score between probiotic and placebo supplementation groups. However, what was interesting that in patients in the probiotic group, that they exhibit less likely or they reported to less likely develop severe bowel-related difficulties over the course of the trial. So basically, probiotic supplementation in this trial helped some common somatic symptoms associated with schizophrenia, so gastrointestinal symptoms, but not mental symptoms for schizophrenia itself. Another study evaluated the effect of lactobacillus supplementation or probiotic on symptoms of maternal depression and anxiety after birth or given birth. This was the secondary outcomes, and primary outcome for this particular study being eczema in the offspring at 12 months of age. This study was also randomized, double-blind, placebo-controlled trial. It enrolled 423 women in Auckland and Wellington in New Zealand. Women for this trial were recruited at 14 to 16 weeks of gestation, so 14 to 16 weeks of pregnancy. They received either placebo or probiotic daily from enrollment until 6 months postpartum. Results showed that mothers in probiotic treatment group reported significantly lower depression and anxiety scores than those in placebo group, showing that this specific probiotic might be useful for prevention or treatment of symptoms of this post-birth depression. In bipolar disorder, this trial showed us that the use of probiotics might be beneficial to decrease rehospitalization in recently discharged patients with bipolar disorder. In this specific study, 66 individuals received either probiotic or placebo during 24 weeks of adjunctive probiotic treatment. During this period, there was significantly low number of rehospitalization in the group which received probiotics compared to placebo. So this is rehospitalization, probiotics, placebo. Also, those treated with probiotics had shorter hospital stay. Interestingly, the effect of probiotic was increased in individuals with elevated levels of systemic inflammation. That's something to keep in mind. Finally, this systematic review evaluated the impact of probiotics on symptoms of depression. The meta-analysis that combined 10 clinical trials with a total of over 1,300 patients showed no significant difference in mood between the treatment and placebo group. However, a separate subgroup analysis, this one, specifically of studies conducted in healthy compared to depressed individuals, found a significant improvement in the moods of individuals with mild to moderate depressive symptoms. So as you can see, the outcomes quite mixed, but at least two trials showed that probiotics might be beneficial for those with symptoms of depression and for those with a higher systemic inflammation. Now, a few words on prebiotics. So prebiotics refer to those non-digestible fibers, such as oligosaccharides, that promote growth and improve the functioning of the probiotics in the gastrointestinal tract by acting as specific substrate. Interventions with probiotics, of course, have advantage of potentially being able to improve gut microbial status more globally, as opposite to use of single strain probiotics, because they provide food for multiple beneficial bacteria. Prebiotics seem to play a beneficial role in treatment of bowel constipation, colon cancer, and inflammatory bowel disease. Unfortunately, most of evidence on prebiotics coming from preclinical studies, but in humans, there are also some promising results. For example, in at least one study in children with autism spectrum disorders. And in this study, supplementation with prebiotics together with restrictive diets caused a significant decrease in anxiety scores. However, other psychiatric cohorts or studies in other psychiatric cohorts, such as major depressive disorder, schizophrenia, or bipolar disorder, provided a very mixed results. Now let's have a quick look at symbiotics and postbiotics. By the way, if you do like to know more on some of these psychobiotics I'm describing here today, I suggest referring to the International Scientific Association for Probiotics and Prebiotics. Their site provides a lot of great up-to-date evidence-based information. That is, so if you go and search for site of this organization, including fantastic infographic you can use in your work and study. All right, so back to symbiotics. Symbiotic is, of course, mixture of live microorganisms and substrates that could be selectively utilized by host microorganisms. This mixture is able to provide some health benefits to the host. There are two types of symbiotics. Complementary symbiotics, when both the probiotic and prebiotic components of the symbiotic work independently to achieve some health benefits, so independent work. And then synergistic symbiotic, when both the probiotic and prebiotic work as team to confer health benefits. An example of a synergistic symbiotic could be a combination of beneficial bacteria such as Lactobacillus species, with its preferred food, such as lactose. So we understand that in synergistic symbiotic, probiotic and prebiotic work together, not independently. Another group of psychobiotics are postbiotics. Postbiotics are derived from microorganisms, but not necessarily probiotics. There's a fair bit of debate on what postbiotics actually are, and you could have heard terms such as parabiotics or ghost probiotics or heat kill probiotics. One thing to remember is that while probiotics are living microorganisms, postbiotics are inactivated microbial cells and metabolites or cell components. There's a range of postbiotics in food we consume absolutely every day. And as well as in diet, this could come in supplements and infant formulas. For example, yogurt or kefir that contains live bacteria, as well as dead microorganisms and metabolites produced by that bacteria during fermentation would qualify as postbiotic. Despite very complicated definitions, when it's come to evidence on the role of symbiotics for mental health, this combined pool is very limited of this evidence. There are some studies conducted on how symbiotics might be used in treatment of depression or autism, PTSD, Parkinson's disease, but outcomes of these studies are yet to lead to coherent recommendations for treatment. In postbiotics, again, very limited evidence. However, one RCT or randomized controlled trial showed the beneficial impact of postbiotics on flu symptoms and mood states in generally healthy adults. My last final couple of final slides are on fermented foods. So fermented foods are consumed across the world owing to their functional and therapeutic properties. Fermentation of foods can occur naturally or by the deliberate addition of starter culture with bacteria such as lactic acid, lactobacillus. It is speculated that probiotic cultures and the biochemical metabolites that are produced as a result of fermentation synergistically contribute to the benefits we tend to associate with eating fermented foods. Fermented foods first were highlighted by Russian Nobel Prize winner Ilya Ilyich Mechnikov, which over a century ago suggested that microorganisms found in fermented dairy, kefir in Russian, or kefir, how we called it in English. So microorganisms in this specific drink might play a role in improving physical and psychiatric symptoms. After this, of course, we understand that many cultures around the world use fermentation process for preservation of foods. And many fermented foods contain microorganisms that could be considered probiotics. However, specific strains and their number can vary depending on food products. And not all food products actually could be considered fermented foods with live probiotics. Over the last century, the therapeutic role of fermented foods has been studied in relation to a broad range of physical and psychiatric conditions. Fermented foods possess a lot of properties and have been shown to aid in elevating the severity of many gastrointestinal disorders. Eatable ferments could also influence gut microbiome composition and its function. They can impact macronutrient metabolism, mucosal immunity, and gut barrier function. Remember, we're talking about that gut barrier function when we talk about dysbiosis. Common probiotic microbes in fermented foods can adhere to that intestinal mucosa and colonize the gut, which contributes to protection against pathogen invasion and modulation of intestinal immune cells. For example, specific lactic acid bacteria, species and strains commonly presented in fermented foods are suggested to modify host immunity by actually stimulating immune cells and potentially resulting in direct anti-inflammatory effects. The therapeutic potential of fermented foods is being researched in relation to a broad range of physical and psychiatric conditions. Preclinical studies indicate the benefits of these foods in relieving symptoms for animal models of depression and anxiety. In humans, evidence to relevance of fermented foods for treating or preventing mental health disorders is quite limited. So when it's come to Indian fermented foods, traditional foods such as dahi or gandrak or sinki, we don't know exactly how they might impact our mental health. So it's up to you to develop studies to explore this. So in summary, I hope my presentation today showed you that diet impacts mental health via several complex biological mechanisms. Gut-brain axis provides explanation on the link between gut and mental health. Recently emerged microbiota-targeted approaches to treatment provide some promising results, but we do need more evidence to come with specific recommendations. Whole diet remains, of course, as most suitable and sustainable approach to treatment. Thank you very much to listening to me. I would like to say thank you to my great team at the Food and Mood Center and those organizations which help our research. And now it's my absolute pleasure to pass on to a fantastic clinician, psychologist, and my PhD student, Gina Holland. Take over, Gina, and good luck.
Thank you very much, Tatiana, for the wonderful introduction. I'll just share my screen. There we go. Thank you everyone for the opportunity to speak today, and thank you everyone for joining us. Tatiana has taken us through the evidence base for a nutritional psychiatry approach to mental health disorders. And now we're moving into the more pragmatic considerations. Just like in medicine, there is growing recognition that the way we approach the treatment of psychiatric disorders is changing. However, how we currently approach treating psychiatric disorders is hindered by several challenges. And these challenges are present worldwide, but seem to carry additional weight in India. Nearly 1 in 5 adults worldwide suffers from a diagnosable mental illness. It causes not only massive suffering, but also great economic waste. Yet no country spends more than 1% of national income on mental health care. If we take a look at the first graph on the slide, it shows how mental health spending is very low in countries of every income level. Even in high income countries, less than 6% of health spending is on mental health. Mental health care does not seem to be a priority. And the situation is exacerbated by distinct differences across countries in accessing service providers such as psychiatrists. Monaco has 41 psychiatrists per 100,000 of their population, and this is the highest rate worldwide. Australia has 9.2 psychiatrists per 100,000 of its population. And a person requiring psychiatric care would be hard-pressed to find a psychiatrist in India, where the rate per 100,000 people is only 0.3. And if we take a closer look at mental health professionals in India, the Minister for Health and Family Welfare was asked in 2017 whether the country is facing an acute shortage of mental health care professionals. And the table on the left on the slide was provided as part of the Minister's answer in Parliament. In a population of 1.2 billion people, there are less than 4,000 psychiatrists in the country. That's just about one psychiatrist for over 13,000 people. And the need of clinical psychologists, such as myself, is 20,000, yet there are only 1,000 available. Table 4 is about WHO figures, which show the acute shortage of mental health resources is actually getting worse. So it's a significant challenge that most people just can't access mental health treatment in India. Now, to its credit, the government has put into motion the framework to help solve this problem for this issue in the long run. In 2017, the Parliament of India passed the Mental Health Care Act, but on-ground effects of these measures are at least a decade away. With close to 250,000 suicides a year across the country, a decade is time that India does not have. Food is one of the biggest causes of illness and the consequent economic burden. However, it can also be the solution. Nutrition is a low-hanging fruit that has already been on the government radar from a physical health perspective. All that needs to be done is to expedite and adapt this process for mental health considerations too. But even if access to practitioners were not an issue, the role of mental health practitioners itself must evolve. Historically, mental health treatment was partitioned from physical health considerations, and the role as psychologists and psychiatrists was to focus on matters of the mind because matters of the body were irrelevant. And nutritional psychiatry is a direct challenge to this way of thinking. It suggests that our physical health and our mental health are interdependent and inseparable. And more specifically, this means that recognizing our food choices influence our mental state and behavior and vice versa. And this necessitates inclusion of practitioners such as dietitians and nutritionists in the prevention and treatment of mental health disorders. Appreciating that our physical health and mental health are interdependent and inseparable compels us all to assist clients with mental health illness to modify unhelpful lifestyle factors such as poor diet. And consistent with this, interventions which focused on dietary change or eating behaviour were traditionally confined to patients with disordered eating or diagnosed eating disorders, or considered the domain of dietitians only. Nutritional psychiatry involves dietary modification or improvement to prevent and manage all psychiatric disorders. Nutritional psychiatry suggests that it's everyone's business. And if we acknowledge a bi-directional relationship between the foods we eat and our mental health, then clearly the practitioner's role must involve boosting awareness towards food choices that support mental health. But the practitioner's role goes beyond patient healthy diet promotion. The American Psychiatric Association recommends nutrition and physical activity counselling be provided for all patients who are overweight or obese, and particularly for those whose treatment involves antipsychotic medication. And this would be many of our patients and clients with mental health disorders. Practitioners need to take a more proactive role in facilitating improved diet quality. And the need for a proactive approach is underscored when you consider the status of diet quality globally. Most of you are probably already familiar with the double burden of malnutrition, with undernutrition on one side and obesity on the other. Greater than 600 million adults worldwide are obese, and 462 million adults are underweight. And undernutrition and overnutrition are interconnected, and therefore double duty actions that simultaneously address them are required. And this double burden challenge is particularly noticeable in India. 1 in 2 are obese, but India is home to 40% of the global underweight population. And a browse through popular media sites reflects the current status of understanding of the links between diet and mental health in India. Emerging awareness and acknowledgement of research in the area, but a degree of hesitation and skepticism. Even more concerning, and just like in Australia, there doesn't seem to be any guidelines or specific policies for nutritional psychiatry or a prioritising of lifestyle approaches in India. So we arrive at a real dilemma for practitioners and researchers. We understand the importance of supporting clients with mental health disorders to improve their diet quality. And even if we could overcome all of the barriers we've already discussed, it's translation into practice that is an unquestionable dilemma. How do we actually support those with mental health disorders to eat healthier? And what do we need to consider? This is an ecological model of factors influencing diet and physical activity. The article by Fitzgerald and Spacatella provides an excellent overview of common barriers to healthy eating and being physically active. And the authors present these barriers at different levels. And the arrow extending across the 4 levels suggests that the factors or the barriers extend into and interact across the various levels. For me, the model shows how complicated it can be to influence diet and really highlights the need for multifaceted approaches to overcome these barriers. Now, changing someone's established diet is notoriously difficult, and even more so for those battling mental illness. Understanding and addressing barriers to healthy eating is very important if we want our approach to be successful and clinically meaningful. There are several internal barriers to healthy eating for those with severe mental illness. The first one is negative perceptions. And this is about having a negative attitude about healthy eating. A client might not think that healthy eating is possible, or they might think that they have to be perfect about it. They might believe that people who have healthy lifestyles are fitness fanatics only. And as clinicians, we can have a key role in challenging these ideas. Another barrier relates to healthy foods not being as tasty or filling. People need time for their taste buds to adjust and need to learn how to combine healthy foods in a way that does fill them up. This is especially a problem if a client is on medication that has increased their appetite. Change in and of itself is hard. And so if clients restrict themselves too much, they might end up rebelling, or worse still, develop perceived helplessness. And this, of course, hinders the development of healthier eating patterns. Using food to fulfill other needs, like using comfort food to self-medicate, is another common barrier for those struggling with mental illness. A practitioner's role in coaching more healthier coping tools is going to be crucial. And finally, prioritizing mental health is also something I hear a fair bit. And this is about the client saying things like, I have enough to worry about without having to worry about what I eat as well. Or saying things like, I'm tired because I'm depressed, not because I have a poor diet. Eating healthier won't make a difference. There are also a range of external barriers to healthy eating. You often hear clients complain that healthier food costs more. Nutrient-dense foods like fruits and vegetables can be very expensive. And it's also true, as countries develop, their food systems get better at providing healthier foods cheaply. But unfortunately, they also get better at providing unhealthier foods cheaply. And this is where a dietitian can really come in handy to provide information and ideas about cheaper, healthier options. Despite this, a lack of access to healthy food is a real concern for those in isolated communities, food deserts, or those facing food insecurity. And there is no doubt that fast food is most convenient. Healthier foods take more time to chop and cook. Fast food is also more accessible for those if they have significant problems with attention, concentration, organisation, or apathy. We also shouldn't ignore the social aspects of eating. It is harder to eat healthier if you're surrounded by others who are not, or it's harder to muster motivation to shop and cook a meal if you're eating alone. And this is something that was certainly relevant during COVID lockdown in Australia. Now, most of those barriers so far have been ones found in the general population, but seem to be more prevalent for those struggling with poor mental health. The impact of psychiatric medication is unique to our clients. Often clients complain about side effects such as weight gain and metabolic abnormalities. And this is almost always demotivating, so we need to keep it in mind. And motivation is central to behaviour change. In the 1980s, two well-known alcoholism researchers introduced a 6-stage model of change to help professionals understand their clients with addiction problems and to motivate them to change. And since then, the model has been applied to many areas of behaviour change. Understanding a client's readiness to change their diet and eating pattern can help you choose the right approach at the right time. The first stage in the model is pre-contemplation. In this stage, individuals are not even thinking about changing their eating behaviour. They might not see it as a problem, and they think that anybody else who points it out as a problem is probably exaggerating. And the example here is, I'm fine, there's no problem with eating takeaway every day. A clinician's role in this stage is to raise awareness. The second stage is contemplation. Here, the individual is willing to consider the possibility that they have a problem, and that possibility offers hope for change. However, people in this stage are often very ambivalent. They're on the fence. So an example might be, I probably should eat healthier. People in this stage, often with the help of a treatment professional, can make a risk-rewards analysis so they can consider the pros and cons of their behaviour and the pros and cons of changing. The third stage is determination, and this is about preparing for action. So all the weighing of pros and cons finally tips in balance of in favour of change. And not all their ambivalence has been resolved, but it's no longer a big insurmountable barrier. And so here an example might be, I'm going to eat healthier, how can I do this? And the clinician's role at this stage is to help the client to make a realistic plan. You can help them make a realistic assessment of the level of difficulty involved, anticipate problems and pitfalls, and come up with concrete solutions. The fourth stage is putting the plan into action. And then the fifth one is maintaining those changes. So they're able to maintain that change behaviour over a period of time. The final stage is about relapse. And so the possibility of relapse is always present, and we need to normalise this. And we need to arm people with a variety of relapse prevention skills. Now, as I present this model, it sounds as though people move from one stage to the next and it's all very neat and things are very predictable. But in reality, it's much less predictable. People move in and around stages, backwards and forwards, in and out of the cycle many times. In supporting people with mental health disorders to eat healthier, we also need to keep in mind some cognitive biases that are likely to occur. And these biases have often been referred to as false hopes. And these particular ones on the screen have been drawn from a webinar on weight management by Glenn McIntosh. So I'll just take you through the 4 false hopes. So the first one would be speed. So people think that they can make changes faster than they actually can. and they anticipate that the benefits are going to happen faster than they actually will. The second one is about amount. So this is where we're likely to overestimate how much we can change and just how healthier we can eat. And this is most likely to occur if we're super motivated. Ease. So this is about thinking that it won't take much effort or it won't take excessive effort. So we are likely to underestimate how much effort it will take to improve our eating habits and diet. And finally, there's rewards. So we are very susceptible to misjudging what the rewards will be if we were to improve our diet. And this is a crucial point when it comes to maintaining gains, because if the rewards don't happen for a client the way that they think they will, they're in real danger of giving up on the changes that they've made. And these, false hopes are very useful for us to know because they remind us of the importance of setting small, achievable and realistic goals for behaviour change with our clients. So what techniques should we use to support behaviour change? Rather than telling you about the techniques, we thought it would be useful to introduce you to a resource. So this resource is called the Theory and Techniques tool. It's an interactive resource providing information about the links between behaviour change techniques and their mechanisms of action. So you can access this tool by the link at the bottom of the screen. It's free for you to use. It's actually a heat map. So what happens is down the left-hand side of the heat map, you can see 74 behaviour change techniques, and then across the top of the heat map are 26 mechanisms of action. And so in the screenshot, you can see that I have clicked on one of those mechanisms of action, and it gives you the definition. Each cell represents a link between a behaviour change technique and a mechanism of action. And each cell can be one of 4 colours, as per the key in the left-hand corner. So stronger links are in green, blue means there are no links, yellow is inconclusive, and aqua means there's no evidence. Oops. So the strength of the link in each cell is determined by a triangulation of data from 2 studies, a literature synthesis study and an expert consensus study. And then if you actually click on the cell, you'll be able to find the data from all the contributing studies. Now, supporting those with mental health difficulties to alter their diet and eating habits can be quite tricky. So we thought we would offer some tips to keep in mind. Now, these tips are probably not news to you if you're already working as a dietitian or nutritionist, but they are likely to be most helpful if you're a psychologist or new to the field. The first tip is around being a role model. This means sending a message to the client that diet is important in mental health by prioritising it in your practice. You need to be well informed and well resourced to support clients to improve their diet. For example, what message does it send to clients about the role of diet in their mental health if you never ask them about their diet, or vice versa, you don't ask them about their mental health? Sometimes your role isn't even to get them to change their diet, but just to consider the idea that diet might be playing a crucial role. Being a role model can be as simple as having posters or fact sheets in your waiting room. And I want to add here that being a role model isn't about what you as a practitioner are personally eating. It's about role modeling in your practice the importance of lifestyle factors such as diet for mental health. The next tip is around keeping it very simple. The information that you provide carries weight and is important, but there is lots of confusing information out there. So consider the idea of chunking. Break everything down to simple components and support clients to make small changes incrementally. Make sure that your advice is feasible and maintainable. So for example, you might ask a client to drink soda every second day instead of every day as a strategy. The third one is integrate, and this one's probably more for mental health professionals or doctors. This means to incorporate dietary considerations at each stage of your practice where possible. It also means being ready to refer on to dietitians. Take the time to know the referral process to a dietitian and try to make connecting up with a dietitian as easy as possible. Next is being client focused. So very often clients have knowledge and ideas about what they need to do, but they feel overwhelmed or confused about making changes. And this is especially so for clients with mental health disorders who are already feeling very vulnerable. We don't want to disempower them further by simply just telling them what to do. So where you can, work collaboratively. And what does this look like? It means being curious about what they already know, allowing them to come up with their own ideas and approaches to change, being respectful of their fears or limitations or where they are motivation-wise. And then sticking to your lane. Comorbidity in mental health is the rule rather than the exception. And most patients will have physical health conditions too. And this makes things very complicated. Any practitioner has to be careful not to overstep the mark by providing specific dietary advice unless you're qualified to do so. Instead, refer the client onto a dietitian or another professional with expertise in the area and support them to see the importance of this step. Something else to consider when supporting people to improve their eating behaviour and diet quality, we need to make sure that we don't promote a diet mentality. Diet mentality is about how we internalise diet culture. It's how we take all of the messages about diet culture that are around us and apply them to our thoughts about food or our body or our weight. So we might not consider ourselves to be on a diet, but because of the diet culture we live in, we still have thoughts, beliefs and behaviours that have been strongly influenced by diet culture. And this women's magazine cover on the slide is a prime example. It's a health magazine, but the focus is on weight loss. With a diet mentality, we're likely to attach some kind of moral code to certain foods. So there are good foods and there are bad foods. And it's also a false belief that diets for weight loss create health and happiness. When you're stuck in a diet mentality, you ignore feelings of energy or hunger, choosing instead to follow a set of dietary rules. And bad habits and diet mentality are most likely to sneak into people's lives during stressful times. I see bad habits routinely, things like eating less healthily and then doing extra gym sessions to make up for it, or drinking alcohol and then skipping dinner to compensate, or doing extended intermittent fasting only to binge or have cheat days. And this table shows contrasting mindsets. And I like it because it helps me to notice diet mindset in myself and others. And the dieting cycle is a trap that many people get caught in after repeated attempts at dieting or restricting food intake to lose weight. And it goes a little bit like this. So the first thing is you restrict a food to try and lose weight. Then you start to feel deprived and your desire for that food or foods you are restricting increases. After a while, you give in to temptation and you eat the forbidden food. And you might think to yourself, I shouldn't be having this. And so you eat it quickly and you don't even enjoy eating it. Now, you probably eat a lot of the food because you think, oh, what the hell, I've already had one, I might as well eat the whole lot. And for a short time, you might even feel a bit better. You might feel relief. But then feelings of guilt make you feel uncomfortable and you may feel like a failure or maybe angry at yourself for not having the willpower to resist. So then that leads to you restricting yourself again to make up for what happened. And then the cycle starts again. Intuitive eating is a way to break the diet mentality cycle. The principles of intuitive eating were first developed by two dietitians, Evelyn Trebow and Elise Rich, in 1995. And there are over 80 studies that highlight the benefit of intuitive eating on health outcomes. And so if you're new to intuitive eating or a client is new to intuitive eating, then these principles are a really great way to start. I'll just take you through a couple. Number 2, honor your hunger. So keep your body fed. Don't ignore your hunger cues. Otherwise, you'll get super hungry and then you'll overeat. 4, challenging the food police. Stop equating your worth to the good and bad foods you ate today. There is no good and bad foods. Number 7 is a particularly important one for those with mental health challenges. So honor your food, your feelings without food. It really is tricky for those experiencing mental health difficulties. And what they need to do is find other ways to comfort themselves, calling a friend, taking a relaxing bath, etc. Number 8 is my favorite, respect your body. Learn to accept your body by remembering your worth doesn't increase as your size decreases. And then the last one I'll touch on is honoring your health. So anti-diet doesn't mean anti-health. You still need to choose nutrient-dense foods most of the time while allowing for some indulgences without guilt. Now, intuitive eating takes time to master. Many clients have been using diet mentality for their whole lives. So for clients who find intuitive eating difficult, support them to work with a dietitian, or if you're the dietitian, support them to turn these principles into long-term skills. And for health practitioners who are not dietitians, nutrition prescriptions are basically one-way healthcare providers can give clients specific direction on how to eat more healthfully or to include physical activity in their routines. And they're consistent with the SMART goal principles. And there are a few important aspects of nutrition prescriptions. Firstly, the whole point of the prescription is to move clients towards increased healthier eating via small incremental changes. And you have to be very specific. So what food, how much are you increasing or decreasing, how often and for how long? You can use dietary guidelines to broadly guide your prescriptions. And the prescription is not just decided by you as the professional, it's based on informed discussion with the client, based on their motivation, their preferences, and what is actually achievable. And in providing a nutrition prescription, you don't need to be a dietitian necessarily because you're not giving specific dietary advice. You're just supporting the client to make small behavior changes. And in doing this, you're highlighting the importance of nutrition for mental health. So this is just an example of a prescription you could write. You don't have to use this format. This is just the way it was presented during my training in lifestyle medicine. At the end of the day, though, role modeling is the most powerful advice. Luckily, there are more and more resources emerging in this area. These are some free posters you can download online. They're attractive and they contain useful information. And displayed in a waiting room, they can be a springboard for conversations about healthy eating with those facing mental health difficulties. lifestylemedicine.org has heaps of resources such as fact sheets, guides, posters. They're all very practical and useful. Gone are the days when healthy eating equals lettuce leaves and carrot sticks. We need to promote healthier eating as being fun and an interesting adventure to explore. And while nutrition education alone will not improve food security or dietary intake, it can be effective when combined with a range of other strategies to help people access healthy food, such as cooking programs, peer education, gardening, budgeting advice, and group-based lifestyle modification programs. So even if you're not the person providing nutrition education, you can still help by encouraging and facilitating access to these other strategies. And on the slide, firstly to the left is a screenshot from the Centre for Nutritional Psychology. This organisation runs training for nutritional psychiatry and provides lots of information about the field. But what I like most is that it has a section on its website called the Diet and Mental Health India Research category, which consolidates research exploring the interdependent relationship between dietary intake and mental health specific to India. Sharon is a service that conducts healthy cooking classes in various cities regularly. They also inform their readers about like-minded cooking classes and events conducted by other people or organisations. They hold training programs for cooking class instructors too. And one of the challenges of any intervention is application. It's tricky when clients learn things in session and then they're unable to transfer that knowledge to their life outside of our room. So how do we get the information to stick? One of the ways is by having clients actually do stuff in our sessions. We need to work harder at modifying content into practical activities so clients are involved in their learning experience. And the following slides will be examples of this approach. Now, before we look at them, I want to be clear, I don't specialise in dietary interventions in my private practice. Improving lifestyle factors such as diet is just one component of my approach to intervening with clients. Much like improving sleep hygiene, I think it's important to improve diet hygiene for clients with mental health disorders. So this is a photo of my whiteboard. So this is an activity I typically use for low mood. So it starts off at the top of the board with some education about the brain neurons, serotonin and depression. And I usually talk about how there are links between low levels of serotonin and depression. Then on the left-hand side in blue, the client and I brainstorm anything that we think could be lowering serotonin levels for them. And diet is one of the key factors that gets listed, and then we talk about that. We then go through and tick the ones that the client has experienced in the last few months, and then we kind of give it a rough score. And often I find people have really high scores. And so we talk about how the question shouldn't be, why are you depressed? It would be, how could you not depress given all those factors in place? And then the next part of the activity is we use all those blue factors that we've brainstormed together to create another list in green on the other side, which are the things that someone could do to increase their serotonin levels. And then I use that list to support the client to identify strengths and weaknesses and to develop some goals. Another whiteboard activity here where I'm having the client rate their own diet. So out of 1 to 10, and then they brainstorm the things that they that might drag them backwards, as well as the things that they could do to move forward in improving their diet. I encourage them to identify small concrete actions. And then we talk about the concept of the importance of leaning forward. In other words, even if we have setbacks, let's look at the list and we can still strive to continue to move forward in a helpful direction. This is an activity for children to try and increase dietary variety. And so we get the children to brainstorm healthy foods that are each of the colours. And they can't think of things, and you surf the net to find ideas. And this is already going to help promote awareness of healthier eating. And then you can set up a reinforcement system or a competition whereby the child tries to eat at least one thing from each colour each day. And I've had some families make this into a competition between family members. And then the kids are telling the parents things like, oh, you haven't had purple, and things like that. The traffic light foods activity is another fun approach. Often it's called Go Slow Whoa. So no foods are evil and no foods are good, but some foods need limits. And so kids can sort pictures or their shop play toys into the different categories. There are so many fun interactive activities for kids. You can see that picture of the doggies, that's actually my doggies that come into session. And kids can feed the dogs strawberries. And then this leads to a discussion about what they can eat and can't eat and why. My dogs would eat hot chips all day, every day if they could, but kids can come up with really good reasons for why we shouldn't let the dogs eat hot chips all day, every day. You know, during this time, kids tend to drop their guard when they're interacting with the dogs, and they're much more open to touching and talking about different foods. Nutritional psychiatry is revolutionizing the way that we think about and approach mental health. Nutrition could prove a powerful lever both in the prevention and improvement of mental health disorders. There are lots of resources out there that you can use with clients to support your work in this area. For example, there's a website called nutritionfacts.org. Here you can watch free videos on more than 2,000 health and nutrition topics. So basically, Dr. Michael Greger and his team summarize the research studies on a particular health topic into easy to understand videos. And they also provide the transcripts and the research links for all of the studies that they talk about. Here at the Food and Mood Centre, we are so excited to be leaders in the growing body of nutritional psychiatry research. And we really look forward to more health professionals making healthier eating mental health a cornerstone of their treatment. That is it. Thank you so much for your time. And Tatiana and I are both very happy to answer any of your questions. I'll just unshare my screen. And then hopefully a host will.
That was really, really excellent. To put it in the Indian way, both guru and shishya, that means the guide and the mentor and the mentee, both of you did an excellent job. Excellent job. Dr. Rox took us through the journey. She introduced us to the family of biotics, psychobiotics, prebiotics, probiotics. It was so very interesting, and I think we need more sessions of those to get into the skin of the gut microbiota. It was really very nice. And as far as Gina goes, really excellent. I mean, the intuitive eating, that was something I really liked. Very nice. And the alarming ratio that you mentioned, especially in India, of the caregivers, the psychiatrists and the people, the ratio that you have mentioned, it was really an eye-opener. As nutritionists, we tend to focus more on the diet, the nutrition, and we put this psychiatry and psychology of nutrition somewhere, on the back burner. Yes, it exists, but today we realize that it's not about it existing. It is very much a part and parcel, a 50-50 kind of partnership which is there, and this is what affects our eating and ultimately our self-image, our body, the surge of metabolic syndrome that we are seeing, the eating habits and the depression and those kind of things that we are observing even at a very young age, right from school kids to adolescents and across the lifespan. Excellent. Thank you very much. And I think we can take a few questions. First of all, I just want to know, someone had WhatsApped me a question here, and they wanted to know that when you talk of approaching a food psychiatrist or nutritionist who is dealing with food psychology, in India, especially in India, there is a lot of people are very apprehensive. There is a stigma attached to going to somebody who is going to sort out your mental health. people are more happy diagnosing diabetes and cholesterol and blood pressure, but they are not comfortable diagnosing their mental status and mental health. So what is your take on this? And I would like to know, what is the comparison with your country? And do you, think people are more open about this now, or, what is it? Yes, Dr. Rox or Gina, one of you, whoever can.
Do you want me to? I can make a small comment.
Gina, you can lead.
Yes, Gina.
I think the stigma around mental health is definitely present in Australia as well, but not to the same extent in India. And that is reflected in how many people decide to go into the profession of psychiatry. One of the reasons that the rate of psychiatrists and psychologists is low in India is people don't choose to go into that profession. And so I think that reflects the comparison between the stigma, but it's definitely present in Australia. And that's why I think it's so important for us to be upskilling dietitians and nutritionists in terms of nutritional psychiatry, because you're right, people will go and see a dietitian more readily to address their diabetes or their heart condition. And then that's our way in. And I don't really mind what they're going to get help for. If they improve their diet for their diabetes and their heart disease, it's going to accidentally improve their mental health too.
Yes.
So it's definitely the way in.
I think two very important things that we should include as nutritionists is nutrition communication, developing the skill of nutrition communication, and developing better skills of nutrition counseling, where we don't focus just on the nutrients and the nutritional aspect, but kind of learn a little bit. Yes, of course, the experts would be then the next step. Referral services of the experts would be the next step. But at least to warm up and to kind of feel comfortable with this kind of a thing, I think we should do that. It is happening a little bit, but only in cities and in the surface. It's not really going deep down, because as you know, our country, we have this big divide of, we have a paradox of problems when it comes to diet and nutrition. So here people are struggling, some with acquiring food and some with, disposing of the excess that they have acquired. I mean, there is a whole lot of difference. So thanks. Yes, Neha, anyone else asking anything from your end, or should I have?
I would like to ask Dr. Rox. So Dr. Rox, you said there's a correlation between the maternal gut microbiota and mental health development in the offspring. So, and also the postpartum depression. So do you think that, because we do know that, previously in India, we did not pay so much attention to postpartum depression, because, we had joint families and there were elders taking care of kids. So the prevalence was probably lesser, or maybe the identification, as both you and Ms. Gina pointed out, was not so much. However, now with awareness, the prevalence of postpartum depression is also increasing. So do you think, and there are more nuclear families, so, the mother and the father are just alone taking care. So that might also be one of the reasons why there's an increase in postpartum depression, because the gut microbiota is going to have some effect on postpartum depression. Do you think that probiotic supplementation could be made as an integral part of, pregnancy diet? Would that kind of, help decrease the prevalence of postpartum depression in mothers?
It's a very good question, Dr. Sanbalal. Thank you for asking it. I just think that it's very important to remember that as far as investigation of probiotics in expecting and young mothers go, we only have very limited number of evidence. So I can't tell you that we should be prescribing probiotics to all expecting mothers to decrease their depressive symptoms. However, we do have few cohort studies, and also researchers from our centers conducted a study when they focused on dietary changes in expecting mothers with the aim to improve their gut microbiota composition and in hope to impact child behavioral outcomes. So, and it's actually showed us that expecting mothers are one of the most motivated groups of people to,
Yes.
to conduct dietary intervention in. They are very willing to listen. They are very health conscious, and they are very willing to make changes, because when we explain to mothers the possible links, it makes their motivation definitely, it's definitely beneficial for their motivation. One thing we need to be very mindful, you mentioned before about stigma around mental health. So unfortunately, we know that many women suffer in silence because of that stigma. They do not want to share their depressive symptoms because motherhood meant to be a happy time. So it's very difficult for them to share with anyone if they do feel not particularly well. And also during pregnancy, how our dietary preferences might change as well. So a lot of mothers, when they're expecting, going through changes in taste and changes in their gastrointestinal functions and the way they feel constantly. So we need to be very careful not to put too much pressure on expecting mothers, because they have enough pressure there. So it's a very gentle balance between trying to help them to improve their health, for their mental health and for the mental health of offspring, but also not to make them feel guilty, because I think we're very quick to make females feel responsible for absolutely everything. So we need to be very careful with that.
Yeah,
Thank you.
I would like to add a little bit because, in fact, even Neha would be aware, like in India, we have certain traditional foods which are allowed or not allowed during pregnancy and postpartum also. Different communities prescribe different types of food. Actually, if you look into that, we can see that a lot of pre and probiotics have been inadvertently given to the lady during pregnancy, or certain type of foods which could be flatus causing, or which could cause discomfort, or not easily digested, are avoided. But they are all under the garb of a tradition or a taboo or something kind like that. And postpartum also, I was very much interested in studying the recommendations of different communities, and I came across is that definitely some of the foods prescribed are either they are full of antioxidants, they are full of DHA, and also some of them have a lot of pre and probiotics. So what we thought was, kind of something forced, like, okay, in the next 10 days you eat this and you get to eat this and you have to eat this. So I remember during my own 2 kids, my grandmother was there, and she would insist on me eating a few things, some which I liked and some which I would not want to eat, and pass them on to somebody else. But later on you realize, when you actually look into that food, you realize what it is. As in, now I can look back and say. So I guess as human beings, we were always aware, all of us, all across the globe, and therefore to keep up the moods, we had different things like baby showers and things like that, to make the community come together, to make the person feel, because hormones, because physical and emotional stress, all this it's a mixture of all that during pregnancy and postpartum also. So I think a lot of more research can be expected from your department, and we would have definitely studies which will, tell us conclusively, yes, these are the foods which are going to help, or these are the combination of foods which should be taken, or rather which should be avoided, or whatever.
So just to
I mean,
add
it was
on
really
to what Dr. Rox and Dr. Mitra suggests, that we in India, we do have a lot of fermented foods which we consume, So I think we also can focus our research probably from the point of, how these particular fermented foods are affecting mental health. And like, we have South Indian food like idli and dosa, they all fermented. We have hanwa from Gujarat, or as Dr. Tatiana Rocks mentioned, dahi, which is equivalent to yogurt, that is available in Australia. So how these Indian foods perform, maybe we could have those and study. And as ma'am mentioned, we need to go back and look more into our traditional diets and identify the components of prebiotics or postbiotics or fiber, which are going to, at the end of the day, affect gut microbiota and thereby improve the mental health. Ma'am, please continue with the question.
I think that's about it. Only there is somebody who has asked whether to control the inflammation and the cortisol levels, as mentioned by Dr. Rocks. If you in the initial part where you talked of anxiety, bipolar disorder, depression, and other neuropsychiatric symptoms and oxidative stress, can one resort to other alternative therapies? Or can you suggest, or are there any alternative therapies for this? Is there anything that comes to your mind?
Yeah, it's a very good question. So if I understand correctly, but the question is about increased inflammation and the impact on depression and anxiety. Yep. Okay, so when we look at inflammation, quite often inflammation in our body come due to different factors. For example, lack of vitamin D, poor sleep, poor skin condition, also lack of exercise, so lack of sunlight or lack of interaction with environment. So, and also diet. When we look at sources of inflammation in our body, diet is one of the main impactful factors. So we see that change in diet can actually help reduce this inflammation. And this is why we call inflammation as one of the biological mechanisms behind mental health. So to work on specifically on inflammation through diet, anti-inflammatory diets are those diets which are based on plant foods with a very high intake of what we call good fats, such as omega-3 fats and poly and monounsaturated fatty acids, with a very low intake of highly processed Western type foods, which we know leads to increased inflammatory response. Even before we see, say, changes in our appearance or increases in weight or changes in blood sugar, we understand that inflammatory response actually presents itself first. And we have this understanding from preclinical studies in animals. There's few studies showed that the differences in diet, how we feed animals, actually impacts inflammatory response very quickly. So working through diet and trying to make changes in the diet to include those foods higher in fiber, higher in beneficial fats would be quite useful for our inflammatory stress, and fermented foods, of course, as well. I hope it answers the question.
Yes, that was very comprehensive overall answer. Very, I think whoever was asking that would be definitely satisfied with this. So Neha, any more at your end, or
no ma'am, that's it.
No, okay, fine, yeah. So that's it.
Excellent. Can I just say I really like Dr. About what you said about we need to look, you as Indian practitioners and researchers need to look at your traditional foods, because unfortunately with that westernization of our world, with changes in our food provision and how what we eat and this great impact of Western culture on all the cultures in the world, we often forget what could be good in our traditional, diet, our traditional medicine. And this is very important because we understand that impact of locally produced foods is very important on our health, physical and mental. So going back and exploring and unpacking traditional foods, and as Dr. Anuradha said, when your elderly relatives recommends you certain foods, I probably would listen and follow these recommendations, because these recommendations goes or stand on hundreds of years of human knowledge.
Yes.
And they're going to be so much more beneficial for us than ultra processed Western style foods which comes into our societies. I'm originally not from Australia, I'm from Ukraine, and I saw in the last couple decades the change in food provision and change in what people eating and impact on their health because of that change in food provision. So I really like the idea of looking back into history and studying traditional local foods. That's a very, very good. Yeah.
Sometimes tradition is a very good research tool.
Yes, absolutely.
If you look at it in a pragmatic manner and not
Yes.
just the superstitions part of it, just looking at it in a very scientific and pragmatic manner, it will definitely be helpful. So all in all, it was excellent, Dr. Rox and Gina. Really very happy to have you all with us. And once again, a very big thank you from NSI. I think Neha is going to do the official honors. Just welcome, Neha.
Yeah. Thank you so much, ma'am. It's indeed my honor to give the official vote of thanks for the 2-day webinar on food and mood and how it affects our mental health. So first of all, I'd like to thank the headquarters of Nutrition Society of India for giving us permission to plan and organize this 2 days webinar. I'd like to thank our convener, the Mumbai Chapter convener, Dr. Subhadra Mandalika, for planning and coordinating with the Food and Mood Center to plan this excellent webinar for us. Also, thank you, Dr. Subhadra, for coordinating and moderating the session on 13th. I would now like to thank Dr. Tatiana Rox for always being so supportive in our endeavors for organizing the webinars in health in relationship to food, nutrition, and mental health. I'd like to thank the entire team at Food and Mood Center, Deakin University, for planning and ideating these 2 days webinars. I'd like to individually thank all our 3 speakers for the excellent talk, Dr. Rox and Dr. Adrian O'Neill for accepting our invitation, obviously, and for providing great insights regarding the role of diet in relation to mental health, as well as the association between physical and mental health, specifically during the crucial stages of adolescence. I'd like to thank Dr. Rox for today's session, wherein she shared in-depth insights on current knowledge about the link between gut microbiota and mental health. Dr. Rox, thanks for explaining the correlation between the food we consume and how it affects gut microbiota and in turn mental health. And also, I want to specifically thank you for bringing up symbiotics, more so postbiotics, because postbiotics are very less talked about topics, especially in India. And so thank you for introducing those topics along with pre and probiotics today. I'd like to thank Dr. Megan Hockey for helping Dr. Rox with the slides on 13th. Finally, I'd like to thank Ms. Gina Holland for sharing in-depth knowledge about nutrition psychiatry. It is one of the least talked about topics, especially in India. Thank you, Gina, for sharing us with the internal and external barriers that can affect healthy eating behaviors. And also for thanking, I'd like to thank you for sharing with us the stages that in changes in any behavioral pattern and the resource for, how we can bring about changes in behavioral technique. I think that's going to be immensely helpful for everybody because they can go and learn different techniques there. Thank you for sharing the tips for intuitive eating and strategies to bring about healthy changes. And as Mitra ma'am mentioned, thank you so much for sharing few India specific resources, because I'm sure that your entire talk is going to be very helpful for not just mental health, but making a change in behavior of eating pattern, because that's what I think a nutritionist needs to do, as to change the eating pattern behavior of any person. Thank you, Dr. Mitra and Chandni, for coordinating and moderating sessions today and last weekend. I'd like to thank my entire social media team for their back-end support in organizing the webinar. And last but not the least, no webinar can be possible without its participants too. So a big thank you to all the participants for registering the webinar. You can view the recordings anytime by going back on YouTube. The YouTube links for today as well as on 13th would be available for your viewing in future also. So the insights shared by the fantastic team at Food and Mood Center at Deakin University, you all can go back and listen to those sessions again. And, because one time listening is probably, not very effective. We need to go back and
Correct, I agree.
listening to these webinars again and again.
Very interesting.
Bring about our real change in our practice. So thank you so much, Dr. Rox, Gina, and the entire Food and Mood team. Thank you so much. Before I log out, I would like to share a few tips, a few instructions for our participants to get the certificates. As we mentioned, that feedback form for both 13th and today's sessions need to be filled to get the certificate. The team has resent the links for feedback form for today. The feedback form will be activated after 2 p.m. and it will be active till midnight tomorrow. And please do not ask us to send us the certificates. If you don't get certificates by 30th, please do send us the links. And because we've been getting queries about our last webinar certificates, we will be sending them out soon. So please, thank you so much, everybody. Thank you so much, Gina. Thank you so much, Dr. Rox. Thank you, everyone, and have a great weekend, everybody.
Thanks for having us. It was absolutely great. It's always such a pleasure to present to your group. It's our honor, and we are very happy that we had this opportunity to disseminate our knowledge and research and share that with you. So I hope that our relationship will only strengthen in the future.
We hope the same, Doctor.
Yes, looking forward. All the very best to you. Gina, all the very best to complete your
very much.
PhD. Yeah.
Thank you.